So let's take a look at your nervous system. You see your spine here? Your brain sits up here. Your brain stem actually extends down into the base of your skull, and your spinal cord runs all through your spine. Everything in your body is innervated off of that. Heart, liver, lungs, kidneys, eyes, ears, skin, immune system, hormonal, endocrine system, all of that's run from your nervous system. So if that's interfered with, it's not going to work right. So if we can get your nervous system communicating properly with your whole body, then you're going to work right. And that's the basis of what we do. Now, when we talk about this nerve supply, it's not just like a light switch that's either on or off. This is 100% life, and this would be death. But think of that dimmer switch. What if the nerve flow to a certain part of your body is turned down and not getting through properly over years and years and years? And that's when the body starts to break down, and accidents and traumas that occur in your childhood, teens, 20s, car wrecks in your 30s, all of a sudden when you're in your 30s, 40s, and 50s, you're having all these issues and you're wondering where they came from. But a lot of times it's because there was pressure on the nerves years before. It's kind of like a toothache. The day you wake up with a toothache is not the day that cavity came. It's just that's when the symptoms and the pain, like an iceberg, kind of popped its head out of the water, and now all of a sudden you're aware of it. But you got this big, huge iceberg that, you know, it just came out of the water. And a lot of times in healthcare, all we do is push the iceberg back underwater until it pops up again. With corrective spinal care, we're trying to remove as much of that iceberg or remove the cause of these problems as much as possible. This is just a little chart that shows how when a sperm and an egg come together to form you, and you start to develop to the 70 trillion cells. Some of us are a little more than 70 trillion sometimes. That how you develop is your brain and spinal cord grow off of those two cells, and then nerves come off the spinal cord, and your organs actually bud off of these nerves. That's how important the nervous system is. It's not only important for your development, but it's important for your function, and it's what heals you. And I just think that's pretty fascinating, you know, how this was all made. Now, so let's talk about this life that runs in you and through your nervous system. And again, I couldn't find a picture of a cut that wasn't gory. So the difference between if we cut this guy's finger and this guy's toe is this one's going to heal. This one's not. What's the difference? He has blood. They both have skin. They both have bone. They both have nerves. But there's no nerve supply running over those nerves, and that's where healing comes from. The body's intelligent enough to tell the body to heal this cut, to clot this blood so that you heal. So that's something that people don't often think about, and a lot of people don't know. They think health comes from outside in, like a pill, a potion, or a lotion, and health actually comes from your body working properly. So let's talk about life. Okay, the purpose of the brain and nervous system is to control and coordinate the function of all tissues, organs, systems of the body. That's Gray's Anatomy. That's what all healthcare professionals learn from. So that's what causes you to be alive, is your brain and nervous system work everything. Have you ever seen someone say, I'm sorry to tell you, family, but your granddad, you know, he's liver dead, so he's gone, or he's foot dead, or he's ear dead, or he's heart dead even. No, they say he's brain dead. So that's when life leaves the body, is when the nervous system, that life that runs through the nervous system to control it, is no longer there. So let's talk about how we can affect that with corrective spinal care. The main thing that we deal with is what we call a head-neck misalignment. An upper cervical subluxation is a fancy term, but we're not into fancy terms. We're into you just getting the concept, so you know what we're doing and how we're helping you and how we can help other people that you now know that we can help. But when that top bone misaligns, it takes the head with it. You know, you don't see people walking through the mall like this, but you do see people with a dropped shoulder and then a dropped hip to try to get that head back to level, because the brain doesn't function right if it's not level. So And that's what causes a lot of the contortion in the whole rest of the spine, is because the head's not level. So let's talk about this a little further here. When we see the head off center like this, we have two problems. There's the nerve problem. This puts pressure on the spinal cord and interferes with communication between the brain and the body back to the brain. If we get that corrected, it allows that communication to work properly. The second problem is that misalignment causes what we just described, the whole body to misalign. And you can have pain in any part of your shoulder, hip, knee, TMJ even. All that is because of the biomechanical imbalance. So if we've got this misaligned curved spine here, then we could crack this, massage this, acupuncture, do surgery. But if we don't get the head back on straight and correct the spine, it's just going to go back. So this is the most important part. And then we have accidents and traumas in the rest of the spine that we have to correct as well, so we can get back to remember that picture of the ideal spine. So let's talk about this. How did your spine misalign? Let me ask you this. What do you think is the first misalignment or trauma or accident that causes the spine and therefore the nervous system to not work properly? What is the first one in most people's life? Falling out of a crib? Yeah, that's a good one. Birth process, that's exactly right. People don't think about that, but the birth process itself can be very damaging and cause misalignment to the spine. In extreme cases, it can cause SIDS or crib death, and a little bit less extreme, it's still bad. It can cause a lot of developmental disorders. And in most cases, or minimal cases, if you want to call it that, it just causes the brain and body not to communicate, and it doesn't develop properly. And so you're a couple degrees off of true north from birth. What does that look like in your 20s and 30s? And we have a profession, or we have a practice full of people like you that it all started back then. It was real easy to correct if we would have just known, and we correct it and then maintain it throughout a life. And kind of like dentistry, you get your teeth, you take care of your teeth from the beginning, then it's just maintenance and it's not all the horrible stuff. So they say that 8 out of 10 newborns are born with a misalignment up here. So basically you can figure 8 out of 10 people can benefit from corrective spinal care to some degree. Now, just like dentistry, some people need a lot, some people need a little bit, but very few people need nothing. And when we check babies, I find probably about 60-70% of them are misaligned, and the rest of them, it's like getting a no cavities report, and that's fantastic. So, but that's just to kind of plant in your mind. These are long-term problems that manifest later in life if they don't manifest at an early age. And if you've ever seen pictures or videos of the birth process, it can be pretty traumatic. And actually, C-sections are even worse. I was born C-section, and when you're little, or when I first learned about it, I was thinking a C-section was like they opened you up like a Ziploc bag or a American Tourister suitcase. But no, it's actually, they don't make the hole real big, and that can be pretty damaging when they pull the baby out. So let's talk about childhood. Any of that look familiar? Your kids, your grandkids? How about you? We're not really made for the feet, the bottom of our feet to touch the back of our head. But apparently, and I hope he was safe, but nevertheless, he definitely got, his body's not meant to move like this. And certainly if an adult did that, that would be even more damaging. Falling on your head, sports injuries. These are the kind of things that cause, in case you're wondering who might have a spinal misalignment and how did it get there. So let's talk about accidents and injuries. Most people have had car wrecks to some degree, but it was just a little one. Well, it doesn't have to be a big one. An accident as low as 8 miles an hour can cause a misalignment. Obviously the slower and lower it was, generally the less you're injured, but nevertheless, that's the way it works.